Tonight, we're going to talk about adversity and health and well-being across the lifespan, about the biology of personal, social, and historical experience, as well as building resilience, healing, and hope. I'd like to ask you to hold a question in your mind as we begin. I want to ask you what the following real people have in common: a cancer patient, a child with school problems, a heroin addict, a politician who can't stop lying, a pro football player who beats his child, and a Native American. Stay tuned, the answer's coming. About 20 years ago, the Adverse Childhood Experiences, or ACE study, was published in the American Journal of Preventive Medicine. This study was the largest, and many would argue most important, public health study of its kind. It was co-authored by Dr. Vincent Felitti of Kaiser Permanente and Dr. Robert Anda, an epidemiologist from the Center for Disease Control. This study looked at the relationship between childhood health and adult illness. Dr. Felitti and Anda surveyed more than 17,000 patients, most of whom were white or Hispanic, middle class, middle-aged, with some college education. All had health insurance. The doctors and their research team developed a questionnaire looking at 10 categories of experience of abuse, neglect, and household distress, as well as physical, emotional, and social health and well-being in adulthood. For each adverse experience that the participants had, they received a point of 1. And the sum of all their experiences was their ACE score. What the research team found was stunning. What they learned was that ACEs are common. 64% of participants had had at least one adverse experience. 27% had 3 or more, and 5% had 6 or more. They learned that ACEs are interrelated. So every participant who had one ACE was 87% likely to have another. And they learned that accumulation of ACEs matters, that there's a graded relationship between experiences of adversity and our risk for disease, disability, social and work problems, and even death. Chillingly, those participants who had experienced 6 or more ACEs had a life expectancy 20 years shorter than those participants who had an ACE score of 0. Looking at these statistics, we know that every day, everywhere, doctors will see at least one patient who's had experiences of childhood diversity. About 5 years later, Dr. Felitti, Anda, and colleagues revisited the ACE study to answer the question, are ACEs merely associated with poor outcomes, or do they cause them? They used 9 public health principles to evaluate the ACE study. And what they found is that the ACE study met all 9 principles for inferring cause. So we can say with confidence that ACEs, in fact, are the root cause of our most pressing health and social problems, from cancer to HIV, to IV drug use, to domestic violence, and even death. We also know now that we can quantify the contribution of ACEs to many of our pressing health and social problems. So ACEs are the most powerful known determinant of health. So you might say, this is really interesting, but what does a study of a bunch of white people in California have to do with us? The ACE study, in fact, was replicated in diverse populations with similar results in 32 states and 31 countries around the world. Here in Illinois, some public health surveys reveal that 32% of children 17 years or younger and 60% of adults have experienced at least one experience of childhood adversity. There was a longitudinal study here in Chicago that looked at lower income and minority youth over the course of about 20 years. And this population, too, had about a 64% prevalence of at least one experience of ACEs. And those participants who had experienced 4 or more ACEs were much less likely to graduate from high school, had higher risk of depression and more likelihood of addiction. They were more likely to have a juvenile arrest or felony charge, and they were less likely to hold skilled jobs or have advanced degrees. So we know that ACEs can change our bodies. But what is the pathway? And with that information, how will that change our approach to solving problems and creating health? I'm a little daunted because we have a neuroscientist in the audience, so bear with me. Around the same time that the ACE study was collecting its data, there was an explosion of sophisticated neuroscience research. So we're going to have a little crash course here about neurodevelopment and attachment so that we can better understand the relationship between experience and health. And I'm going to pull out my handy model of the brain. And for the sake of argument, we're going to imagine that the brain is composed of three parts: the brain stem, or the survival brain, the midbrain, or the emotional brain, and the cortex, or the thinking brain. Our brain is responsive to experience. It develops from the bottom up, from the survival brain to the thinking brain, starting prenatally and going till about age 24. There are critical and sensitive periods of development. So for example, if we're stuck in a room with no light during the critical period of development of vision, we'll be blind. Attachment is a special emotional relationship which involves the exchange of care, comfort, and pleasure. Our attachment styles are established in our early infant caregiver relationships. Attunement is our ability to understand and perceive the needs and wants of others. Childhood adversity and trauma can cause toxic stress, disrupt attachment, and derail the optimal development of the brain. It's signaling to the autonomic nervous system and other body systems and our overall physiology. Attachment and attunement help to protect us from the consequences of adversity and from distress, stress, and trauma. So you're probably wondering, what do genes have to do with all this stuff? Our country has spent lots and lots of money looking at genetics. Well, it turns out that genes are in a dynamic relationship with the environment as well. And genes have markers called epigenes that respond to the environment and turn genes on or off, making us healthier or sicker. And these genetic modifications can be passed from generation to generation to prepare us for the environment that we'll face. Recent research has revealed that children of Holocaust survivors have in fact inherited genetic modifications that can be traced back to their parents' response to stress. So we know that adverse childhood experiences change the body, but what about poverty and discrimination and violence? In 2014, Dr. Roy Wade and colleagues in Philadelphia developed an expanded ACE questionnaire that included many indicators of adverse community environments, like violence and community disruption, economic hardship, and problems and conflict with systems like schools, child welfare, and the juvenile justice system. And guess what? Those things are really important too. In fact, those adverse community environments cause the same kind of changes in our brain and our physiology and behavior as adverse childhood experiences. You won't see it here, but there are things lurking in the soil as well. And those things are experiences of historical trauma, like slavery, cultural genocide, and Holocaust. And they have an impact on our brains and physiology across the generations as well. So, in summary, our genes, epigenes, and experiences, their timing, severity, and chronicity all shape the growth and development of our brain and can lead to adaptations that are hardwired into our biology that cause chronic disease, mental health problems, work and social issues, addiction, crime, poverty, even disparity, and these things can be passed from one generation to the next. So we know that there's great cost in human suffering, but what does this cost us in dollars and cents? In 2014, it was estimated that each first-time episode of childhood maltreatment would cost about $1.8 million over the course of that victim's lifetime, and about $6 trillion in total for all those victims. Imagine how much good we could do with that money. So let's take a deep breath, because that's heavy stuff, and we're going to talk about some good news. We humans have some really cool things going for us. Our brains are plastic. They actually respond to our experiences in our environment, both in terms of function and structure, over the course of our whole lives. We also have the capacity for resilience, which is the ability to bounce back. And it turns out that secure attachments and social support help us build resilience. We need to use these ideas and embed them in strategies throughout our human ecology, from the individual level all the way through the structural levels across time. We can do things like raise awareness, build individual knowledge and skills, train our service providers, change organizational practice, and even influence policy, legislation, and high-impact conversations. Where do we start? Well, we start at the beginning. We give our parents and families the tools and resources that they need to be their best selves so that they can foster secure and attached relationships with their children to build healthy bodies and brains. It's really that simple. We have to ensure the basics for everybody. We need to make a commitment to social welfare so that all of us have our physiologic needs met, our needs for safety and security, and for love and belonging, so that we can find our true purpose and fulfill our potential. Interestingly, with all this scientific evidence, not much of it has made its way into curricula of medical schools, colleges of education, nursing, social work, law, or business. Many of these schools are stuck in a paradigm that focuses on high-stakes testing, zero tolerance, and a pill for every ill. But we can develop a new paradigm based on science, history, and justice that includes time-honored practices of cultivating awareness through meditation, moving our bodies, using the arts for creative self-expression, and fostering healing relationships where we don't ask what's wrong with you, but we ask what happened to you, where we listen with acceptance, and where we respond with compassion. We can use trauma-specific treatments like neurofeedback, EMDR, and ecotherapy, which, by the way, is going outside. All of these activities and treatments help to settle down our autonomic nervous systems, heal our brains, and foster flourishing. I'd like to give you a few specific examples. There are many, many, many around the country and around the world. Here at UIC, there's been a pop-up pantry to serve students with food insecurity so that they can be well-fed and ready to learn. On the West Campus at UIC, in the emergency room, there's a Better Health Through Housing program, which has housed 25 chronically homeless patients. The patients are thrilled, and the hospital is saving $2,000 per patient per month. In Walla Walla, Washington, an alternative school has adopted trauma-sensitive practices, provided many opportunities for creative expression, and focused on healing relationships. They have decreased their suspension rate by 85%. They've improved grades and attendance, and their graduation rate is up from 18% to 78%. And finally, in Washington State, the legislature has made a commitment to parents who have been arrested to keep them from going to prison so that the state won't be adding another ACE to vulnerable families. The promising results from this program are that only 6% of ex-offenders have returned to prison, and only 8% have committed another felony. So, if ACEs could be eliminated, we could increase our work productivity by about 61%, decrease suicide and life dissatisfaction by about 67%, and decrease anxiety by about 56%. And frankly, that's just the beginning. So in summary, our experiences, current and historical, individual and collective, shape who we are because they affect our biology and they chart the course of our growth and development. Humane social conditions and secure attached relationships help build resilience and allow us to weather life's storms. We have the knowledge and the power to prevent, mitigate, and treat the cause of our deepest suffering. And we have the ability to allow all of us to find our true purpose and fulfill our potential. Our lives and the lives of the next 7 generations depend on our putting this knowledge and skills into practice. Transformation's possible. Transformation's imperative. I'd like to ask you to join me in acting now. Let's just do this. Thank you.